The goal of Canada's health charities is simple and straightforward: a healthier Canada. That's why every day we're supporting the 87% of Canadians who are likely to be affected by chronic disease or major illness in their lifetime. We are Health Partners, a collaboration of 16 of Canada's most trusted and respected health charities, representing some of the most devastating chronic diseases and serious illnesses faced by Canadians. Since 1988, our campaigns have raised over $170 million for life-saving research, services, and programs. We couldn't have done it without the generous support of public servants like you. For that, we say thank you.
I always wanted to play goalie for a hockey team, but since I was sick, I didn't get the opportunity to.
Living with a liver transplant is kind of rough, but I wouldn't take it back.
So both Jessica and Murtis were born with rare genetic type liver disease.
Well, the story begins when Paul and I have been fostering for a lot of years. So I received Jessica at 1 year, 1 day old. Right away, we knew that she had liver disease. She was a very, very sick baby.
They needed to be close to medical care because their drug list was well over a dozen medications.
Nothing prepares you until you see your little baby bleed from her eyes and ears and nose and have to rush to the hospital. And at one point in time, they had said to me, she's not going to make it. We were in the PICU. Her blood pressure was 300 over, I can't remember, but they said it's just a matter of time. Just stay with her. She had 15 IVs going, and it was the hardest thing that I've ever done. I didn't know what to do, like they're standing there, and so I sang. I started singing, so I sang Amazing Grace. And by the first verse of Amazing Grace, her blood pressure was normal.
It's successful. Like, sure, I've had a few rejections, but that was when I was 14, so 7 years ago. So now I'm healthier than when I was. So.
When Jessica was 3, they located her brother Murtis, who was just a few months old.
He was so malnourished that it's like the little children from Africa you see with extended bellies. And Dr. Schreiber was able to diagnose he had the same diagnosis as Jessica. They took him for liver transplant. He did amazingly.
But at the age of 6, Murtis was diagnosed with cancer, lymphoma.
I was air ambulance down to Children's again, and then I had chemotherapy.
One of his medications was actually the cause of his lymphoma. I'm hoping with research that they can figure out how to get them off the transplant drug.
The liver transplant has allowed them to survive, and survive in a way that they can make a huge contribution to society and impact so many people.
This is so important to save lives, to save children. Babies that are born with liver disease don't have a choice.
We're just very proud.
My kids have grown from such a fragile state to, I consider, a most amazing kids.
Love, strength, perseverance, and advancement in medical research can conquer liver disease.